Good to go, Dr. Les.
Okay. Greetings, everyone. I see East St. Louis is in the house, Baltimore. Just tell us in the chat where you're joining from, if you don't mind. Yes. So greetings, everyone. I am Leslie Farrington. I am a retired OBGYN and a big fan of our author, who I first met in the late 1980s when she was a nurse and I was a doctor in training. So it is my distinct pleasure to introduce you all to Dr. Janet A. Williams, known to many as Dr. J. And Dr. J is a certified nurse midwife, educator, maternal health advocate who has spent decades supporting families as they welcome babies earthside. She has attended more than 900 births. Dr. J is the conversation starter regarding maternal health inequities and the patient experience. And she created the Black Mothers Interrupted Framework, and Black stands for, and this is a training for medical professionals to recognize bias, that's the B, honor lived experiences, lived is the L, amplify Black voices is the A, promote cultural congruence, the C, and ensure that knowledge K gained is shared. Dr. J also serves as the national chairperson of the Maternal Health Committee for Chi Eta Phi sorority and is a member of National Black Nurses Association's Maternal Health Equity Committee and the Greater New York City Black Nurses Association. Dr. J will be speaking on the role of midwives in women's health care, and she'll be sharing practical wisdom about the birth journey. And she will share reading excerpts from her book, Transitions, a Midwife's Pregnancy Reflection Journal. Now, if you'd like to continue the conversation beyond this session, you can go to her website and connect with Dr. J online through LinkedIn, Instagram, Facebook, etc. So please join me in welcoming Dr. J. Now, Dr. J, before you read a selection from Transitions, please tell us about your career path to becoming a midwife And for those who may not be familiar, tell us about the role of midwives in women's health.
Okay, very good. Leslie, I am so excited to have this time to share with you and the audience why this book was written and a little bit about my journey. First of all, for those who are unfamiliar with midwives, let me start here. A midwife is a health professional who cares for women and birthing people across the lifespan. Most people meet us during pregnancy, but we also provide care before pregnancy and after birth. At the heart of midwifery is partnership. So we listen, we educate, and we support families through one of the most important transitions of their life. Midwives include a full range of services such as annual exams, birth control. We do STI testing and treatment and preventative care. And we also support people, and it's like continuous care. So we walk alongside of women. But my work didn't start when when I became a midwife. I had already been a nurse for about 20 years. But the foundation of this work started much, much earlier. It started years ago, before I even met you, Leslie, when I was a married teen mom. And I was unprepared for the experience of birth completely. And honestly, it felt like I was on a conveyor belt. There was no individualized care, and it was their hospitals and their rules, and I basically followed along. There were so many policies and procedures and expectations that guided everything: the visiting hours, the nursery hours, rules about who could or could not be in the delivery room. And the thing is, there were really no options because no one was allowed in the delivery room. Not your husband, not your mother, no one. And that was considered care back then. And at the time, I didn't question it. I just found out that I had received an injection just before I was discharged that would dry up my milk. And there was no discussion, no permission. So, in fact, breastfeeding had never even been mentioned the whole prenatal course. But looking back, what kind of option did that give me? I ended up laboring alone, and a nurse occasionally would come in the room, and I didn't ask any questions, and I didn't share what I wanted, and I didn't find my voice at that point. I didn't even realize I had a voice, unfortunately. I just thought that that's how the system worked. But something did stay with me. My rights to breastfeed had been taken away without any regard to my wishes at all. So then jump forward a little bit. My father died when my son was 3 years old. He had been taken to a hospital in the suburbs that was unfamiliar to me, and he was there for 12 hours before I even knew that he was in the hospital. And when I got there, I found out he was the only person of color in that ICU. And my first thought was he probably had not been treated well. And unfortunately, I was very wrong. Fortunately, I'll say, the staff had cared for him so well, but that's the first time that I realized about bias. I didn't know what to call it at the time, but it was bias. That was my thoughts, my assumptions. And that moment changed me. I learned to take a breath and pause and to check my own assumptions and to meet people where they are and not where I think they were. 3 years later, I got out of nursing
Dr.
school.
J, can I interrupt?
Yes,
Is it me or
yes.
is she sounding warbled to everyone else?
You can't hear me?
Can you guys hear okay?
There's
Do
a,
a maybe it was just mine. You were
Yours?
warbling. I'm sorry. I hated to. Yeah. Oh, you are choppy.
Okay.
You are choppy to some. It might be
Somebody
that
say
you're
this
too far
garbled
from your.
in
You
the.
might be a little too far from your mic, Dr. J.
Okay, how's that? Is that better?
Yes.
Or should I turn the volume up a little bit? I don't know.
It wasn't the volume so much as you sound good now, whatever you did. We just didn't want to
I
miss your
just moved it
story.
closer to the mic. Yes, yes. Okay, no problem.
Thank
Okay,
you.
so years later, I became a nurse. Can you hear me now better?
yes.
Yes.
Okay, excellent. So I went to nursing school, and years later, I became an L&D nurse, and that's where I met Leslie. And I fell in love with the families and the work that I was doing. It was transformational. I had the privilege of watching expected families not only give birth, but become parents and form relationships and step into new family dynamics. But I did
It's a,
still see how
it's,
the policies and procedures, yes.
it's your connection. I think it's the connection. But I can still hear you, but it's breaking up just a little bit.
Mm, okay. saw these new families step into their new roles. And then I transitioned into home care. And that's where I had my aha moment. I started to see people in the fullness of their lives, their families, and their communities. And I saw the strength that patients have. And I realized that as health professionals, we don't need to save anyone. That's not our role. The role is to educate and to support and to make sure people feel confident caring for themselves. So they have to be the center of their care. And when all of that came together, my years as a nurse, my years in home care, my understanding of how power shows up depending on your settings, it took many years until it all came together. And that's when I decided to become a midwife. So I went back to school and I became a midwife. And I knew that that is exactly where God wanted me to be, because I was able to put together all of the lessons that I had learned and understand how to actually support and walk alongside families and mothers during this important period.
Okay, I would suggest that that you either turn off your camera.
Wait,
Yeah.
I think, Dr. J, you're logged in twice as a panelist. Do you have two devices in your space?
No, just one.
Um,
You want me to try to log out and come back in?
um, there's a second, yeah, I apologize, everyone, but we want you to be able to hear her and have the full experience. Um, she is logged in twice,
Yeah, you're
but I
logged in twice. Your name is you see your name is on the screen twice.
but I hate
There's
to
your picture.
remove you because that may, okay, I'm admitting you on another one. But somehow you joined in twice, Dr. J, and I think that may be part of the problem. Okay, good. Now
Okay,
we're
so
going to
you just
have you
asked
on.
to admit me again.
I just did. Try
Does
talking,
this
Dr.
sound
J, to
better
see if that
now?
makes it does sound better.
Does this sound better?
It does sound better. Yes. You guys keep going and we'll see. But and that other login went away. I removed it. So let's see if that helps.
Okay.
So you were talking about how you became a midwife after being a nurse for 20 years. So that was where we
Yes.
Okay, and
So
then
we can go on to the
okay.
next question.
Okay, very good. So so now we want to hear about the book. What made you write this book, Dr. J?
Okay, just to let you know, I'm hearing a lot of static now on my end. Are you hearing me clearly?
Can Marie, is my sound okay? Hmm. I think my sound is okay. I got a heart came up.
Okay. All
So
right.
how if you know it may be that we have to go off screen. I don't know. But that's what you do when your
Someone said
connection's
that
not.
they can hear you okay, but they can't hear me okay.
So you might need to go off screen. I would try that because the main thing is to hear you.
Okay, I'm going to sign out and log back in. Is that okay? Yeah. Should I do that quickly? Try.
Okay.
Okay.
In the meantime, I want to show everybody the t-shirt that I'm wearing. This is something everybody needs to know, that midwives were here first. And in every other country, it's most babies are caught by midwives. In the United States, we don't realize that. And my GYN, and I'm in my senior years, my GYN is a midwife. So midwives are women's healthcare providers throughout the life course. And I hope we can get Dr. J back with a full voice. Now, we're going to be having a couple of questions we want you to think about in advance of the two questions we're going to ask. And one is, do you know your family history? Yes or no. That's going to be, you don't have to answer yet. And then who in your family would you need to ask about your family history and your medical history if you needed to? So we're going to ask those questions in a little bit. Let's see how we're doing. Oh, we already put the poll up, so we might as well go.
Great. That's great.
Yes. So who in your family would you ask? Oh, that's the second question. So if you don't know your history, who would you ask? We'll put it that way. And I don't know how you respond in Zoom to a poll.
It should be on their screen for them to select a choice.
Oh, you can just click on it. All right.
And it is the first
I'm
question.
trying. It's not working for me.
Okay, I'm back. Can you see me and hear me?
We can.
Yes.
And I don't think it allows you to participate as a panelist.
As a panelist.
Mm-hmm.
All right. So let's get back to you're going to tell us about why you wrote the book.
Okay, good. So basically, I wrote the book because I wrote the book that I wish I had had when I was pregnant. I wish someone had shared information with me and asked me questions and helped me think more about my pregnancy before I got to the delivery room. My own experience showed me what it feels like when care wasn't centered around the person that they're taking care of. Most pregnancy books were written just with timelines and symptoms and checklists, but I wrote transitions with you in mind. It basically invites expectant parents and partners and support people to pause and to reflect and to really have time to think about the journey, not just move through it. Because when you take time to process your emotions, your fears, and your hopes, then we know that that can reduce stress and support the overall well-being during pregnancy. This journal holds space for more than just clinical care. It talks about clinical care, but it supports the lived experience of pregnancy and becoming a parent along the way. I wrote it because too many people are still navigating systems that don't listen, and too many are still on that conveyor belt. Every single day, you have 9,634 people moving through pregnancy and birth without their full experience of being heard and seen. And that's the work, to listen differently and to care differently, to build systems that don't just deliver babies, but that honor people. I wanted to educate those in my community differently. So it's a place to be seen, heard, and prepared during one of the most important transitions of your life.
Yes, and I've been through the book a few times, and it's a place of healing. It's a place of healing because you're journaling along the way, and healing is important for positive pregnancy outcomes. So please, Dr. J, share with our audience your advice about putting together a care team for their pregnancy, birth, and postpartum, and choosing a location for giving birth. And while you're at it, let's hear a reading from Transitions.
Okay, excellent. So when we think about pregnancy and birth and postpartum, it's one of the most important decisions that you'll have. And who's walking through that journey with you is so important, because birth is not a clinical event, it's a life event. And the people that you choose matter. So there are a lot of choices of providers. You can partner with several healthcare professionals. Midwives, we center pregnancy as a normal life event, and we provide holistic care and continuous care. Physicians now manage pregnancies and births, but they're also experts in managing the high risk conditions and surgical care when it's needed. Nurses are the ones at the bedside, often your closest point of contact during labor. Then you have doulas, who are your non clinical support, emotional, physical, and educational, and your steady presence. You have lactation consultants who can support you during feeding, bonding, and in those early postpartum days. Sometimes you might be referred to a nutritionist to help you with your diet, to help fuel the body for pregnancy, healing, and recovery. And then we have therapists that might be part of your care who can support the mental health and help you adjust emotional health, which is just as important as physical health. And here's the key: it's not about who's on your team, it's about whether they listen to you, respect you, and include you. I remember there was a patient who had everything when you look on paper. She had insurance, she came to all her visits, and she delivered in a hospital. But after her birth, when I asked her how she felt, she paused for a moment and she said, "I don't think anyone asked me what I wanted, not once." And she was cared for, but she was never included. And that stayed with me because we can check off every clinical box, but if we miss the person at the center of the experience, what does it matter? And let's talk about where you give birth. There's also different settings where you give birth. There are 3 primary birth settings. You can have a baby in a hospital. About 97 to 98% of people deliver in hospitals at this point. There are also birth centers, and there are people that deliver in home births. And each one of these comes with different approaches to care. And the question isn't which one is the best. The question is which one is best for you, your pregnancy, and your vision of birth. And basically, the reading from my book is that this journey is not about preparing for a baby. It's about preparing you for who you are becoming. Take time to build your team, your space, your support, not just for the day of birth, but for the days after. And ask yourself, who listens to me? Who sees me? And who will stand with me when I need to speak and when I don't have the words? Because the experience matters. Not just how the story ends, but how you live through it every moment. And if I leave you with anything, it's this: you're going to choose a team and a space where you feel safe, informed, and heard. Because when we close the gap between how care is delivered and how it's experienced, we don't just improve outcomes, we transform the journey.
Man. What are a few things someone can do to prepare for their first prenatal visit and so they can get the most out of it? And when should the first prenatal visit be scheduled?
Okay. I think the first thing is that the most important step, I think, is to sit down and to get a complete medical history from your family. That's the grandparents, the parents, and your siblings. And also ask about your history, okay? Because many things happen to us as children that we never hear about. I still shudder as I think about an image of an MRI that I saw. That picture stays with me. It was a patient who had done her entire prenatal care with us, and she delivered. The day after her delivery, she began to complain of a very severe headache, and the doctor sent her for imaging. And what they saw was a very shiny object. When her mom came in to visit her, who lived out of town, she was asked about it, and she paused and said, "Oh, she had surgery as a baby. She was just a few months old, and she's been fine ever since." In the end, we found out that this woman had had brain surgery as an infant, and a metal clip had been placed in her head. And this, where the scar was under her hairline. The patient never knew anything. There was no visible scar. She was never told, and the patient was totally oblivious. And so this was where we were going to do your health history, but you've done that already. So because when you come in for your first visit, you should come in with that kind of information. And you don't receive care, you're going to begin to participate in it from that first visit. And this is exactly why that first visit is so important. And it's usually scheduled between 8 and 10 weeks, because it's not just about labs. It's about telling your story. It's about bringing in what you know and even what you're still learning about yourself. It's about discussing plans for your prenatal care and understanding what services and supports are available. Visit schedules, talking about options for group prenatal care, talking about, do you want a home birth or a hospital birth? What are you thinking? It should be explaining about, they should explain to you about what tests they're going to do, blood tests, sonograms, or their childbirth classes. It's about beginning to share and make a birth plan with your provider. And in the chapter Welcoming Space in my book, Planning Your Prenatal Visit, we encourage you to start thinking about what matters to you, your preferences, your concerns, your goals. And bring your partner, your support people if you can, because they're part of this journey too. And the most important thing is to pay attention to how you feel during that first visit. Do you feel heard, comfortable? Because that matters just as much as anything else that happens in that visit. And if you get to a provider that you don't feel comfortable and you don't feel like they're listening to you, you need to, first of all, let that provider know, I don't think you heard me. Have them read back to you or say back to you what you said. And if you still don't feel comfortable, I would tell you to get a second opinion or find another provider. And you do that early in the pregnancy. You don't wait until it's time to deliver to realize that this person never listened to you.
But you want to feel like you're partnering with that doctor, midwife, whoever it is. You want to feel like your partner and they are not your boss, right?
That's correct.
Right. And if you don't feel comfortable, you could say something, and that might help them humanize you, right? I mean, it's not that easy to switch. So if you can work with someone, that would be great. But if you can't, try early. But I've seen people switch later in the pregnancy too.
Yeah.
All right. So
I wanted to read a little bit. I don't know. I know we're behind time. I don't know if we're going to have time to read a lot from this chapter, Welcome in Space. But I just want to say that many questions and concerns do arise during your pregnancy. So it's essential to create an environment where you feel comfortable asking them. This chapter encourages open communication with your health provider, partner, and support team. Consult your healthcare provider to create that birth plan and to include appropriate medical care and monitoring that aligns with your needs. And in this chapter, the first thing I put in here is your Bill of Rights. You go to the appendix and you should know what your rights are from the first visit. And questions matter. Pregnancy is such a time for change. It's a time to feel unsure. It's a natural to feel unsure about what to expect and what's normal. So asking those questions help to understand your body changes and feel informed and more confident in your decisions. And it helps you make informed decisions because you need the facts and resources to have your questions answered. And it starts to build trust with your healthcare provider and addresses concerns early to prevent unnecessary stress.
I go to the next question?
Yes, ma'am.
Okay. What is one thing expectant parents often wish they had known earlier?
Wow, that's a whole list. That's more than one. Because pregnancy moves so quickly, it basically, when you slow down, the experience feels very different. So one of the biggest things I hear is that I wish I had taken more time in choosing my provider. The other things that I hear is that we are incredibly thoughtful when we make decisions in our life. We research vacation venues, we research colleges and universities, we read reviews about joining gyms, and don't let us buy a car. We know every bell and whistle that's on it. We take time and we ask questions. We make sure everything feels right. But when it comes to our health and pregnancy, one thing that we don't always give the same level of attention to, unfortunately, about who will care for us. And that relationship matters because birth stories are forever. And how you're supported and how you're heard stays with you forever. Another thing I often hear from new parents is, I wish I had understood what support looked like, not just during the pregnancy, but once the baby arrived. Support is not just showing up, it's showing up with intention. And many families wish they had planned earlier. Um, some people say they wish they had known that they didn't have to go along with everything, that they could have been part of the conversation. I wish I had known what to expect emotionally, because pregnancy isn't physical. There's a lot of mental, emotional, and life changing things happening all at the same time. Someone said, I wish I understood the postpartum period better, not just the baby, but what happened to me and what I needed to recover and rest without support, and how those early weeks really are. I wish I had known how important my village would be, and that who I surrounded myself with mattered just as much as the care I received. And if I could bring it all together, I would say this: take your time, ask your questions, and choose your provider and support system with intention. Because when you do that, you don't just prepare for birth, you prepare an experience that will stay with you for a lifetime.
And this is this is what comes across so much in your book.
Yeah.
I have to say, it's to plan and to get ready is so important to the overall experience. Yes. Should we ask the question, what does support looks like now?
Nope, we're going to do that in a little while.
Okay.
Yeah.
All right. So how can partners, family members, or a support person like a doula be involved in prenatal care and help strengthen both the pregnancy journey and postpartum life?
Okay. I'm going to say, first of all, you're going to come to your visits with your questions, and you're going to bring your partner, your husband, your support people with you. Start from the very beginning, having them involved. I remember a patient who came for her visit with her doula. And the doula came in and had a notebook, and she was writing the entire time that I was talking to the patient. And at the end, I asked her, the patient, and the doula, I said, do you have any questions? And she smiled and said, you answered every one. The patient and the doula had sat the day before, and they spent hours preparing this list of questions about delayed cord clamping, about skin to skin, about the golden hour, about breastfeeding immediately after birth. And the moment stayed with me, because what it showed me was that when someone feels prepared and supported into their care, support doesn't just happen at that appointment. That had started the day before. Pregnancy isn't meant to be experienced alone. Partners, husbands, and support people all play a big role in this. And I also remember that there was a young woman that came in my office, very quiet and pensive. Her husband, I found out, was deployed, and she was in a city with no support systems nearby. So we created a support system for her. I talked to her and introduced her to other patients that came on the same day as she came. And we talked about possibly getting her into group prenatal care, which we finally couldn't because it was during COVID. And then she found a doula who became a strong support system for her. She even would call her husband during our visits so he could hear the baby's heartbeat, and he was part of it that way. And in that moment, she wasn't alone anymore, because that's what support can do. You can build a support system. Fortunately, her husband got back in time for the birth, so he was there for her. But he felt that he had also experienced the pregnancy along with his wife, and that she was supported on our end. When we talk about how support and understanding can make a real difference for our expectant mother or parents, this book continues to help by letting people know that often the person who needs this journal that we're reading from isn't the one that is holding it today. So they may be someone that you know. So this is the time now. What I'd like you to do is take a moment and think about this. At some point in all of our lives, most of us need support, or either we have the opportunity to support someone else. Support is not complicated, okay? But it's intentional. So I want us to start to begin to think about support that way. What, if you're expecting parent, what do you think you might need? And if you're someone who is in their community support community, what could you offer? Okay. And I would like you to think about this. And We're going to all write it in the chat, and Leslie's going to let you know when to hit send, because we want to see what you think support looks like. That's very important. If you see what support looks like or what support you think might help someone.
So 1 or 2 words on what support looks like or feels like. And I'm going to count to 5. And when I get to 5, we're going to all push send on what we write in the chat. So write it in the chat and wait till I say go. And then everybody pushes send. And that's our way of doing a word cloud without special technology. So when I'm going to count to 5, when I say go, then everybody will press send. 1, 2, 3, 4, 5, go. Love, understanding, patience, and peace. Showing up with food and ready to help. Being available.
Planning and organizing, joy.
Listening.
I like this one.
Support feels like a warm hug.
Yeah, that one I love.
Cleaning.
Okay.
Surrender.
Okay.
So support, wrapping a birthing family around a cocoon with a cocoon of support is one of the most important things we can do to improve maternal outcomes, reduce the stress that people are under, which allows them to heal from the stresses of life, and that improves outcomes.
Yes. So I see a lot of words: staying, listening close, being available when needed. I love it. So sometimes we have to take it a step further, because support isn't always a feeling, it's also an action. And if we're not careful, sometimes people will say things like, let me know if you need anything. And you know what? We never follow through. So let's name it. What can support look like? I've seen some of it in here, but let's go through a small list of some of the things that can be supportive. It can look like dropping off and picking up their other children from school. You're walking right past their house, just say, I'll walk your child to school. Helping with homework, setting up play dates for older siblings, doing a load of laundry or folding what's already there, picking up something at the grocery store so that the house can be stocked, doing meal prep, or simply bringing a meal, coming over so a mom or birthing person can take a nap or even take a shower, helping with story time or bath time for other children, babysitting for an hour or 2, driving them to an appointment. These are the things that lighten their load, and these are the things that tell them you're not alone. And when we begin to think about support this way before the baby arrives, we can change the entire experience for that family, because this is what we mean when we say support. One of the reasons I created this journal was to help families think about these things long before the baby arrives, because when support is planned, it shows up really differently.
And I have to mention that the next book, the next author, and that right after this is going to be about postpartum support in the African American tradition. So we're going to hear Mothering the Mother from Mama Shafia Monroe. So we're going to hear more from transitions, and so the next question is, what advice would you give someone who feels that something in their pregnancy or postpartum doesn't feel right, but they're unsure how to speak up or whether to speak up? Yeah. And please do one more reading from Transitions.
Yes. So I'll tell you, I always tell my patients, always say something, even if you're unsure, if you can't even explain it. If something doesn't feel right, let us know. You know your body better than anyone else. And I always say that God gave us intuition for a reason. That feeling that you feel, that pause, that something isn't right, that's not something to ignore, because your voice matters. Communication is part of safety. It's not just what we see clinically, it's what you feel, what you notice, and what you question. And too often people wait because they don't want to be a bother or because they're not sure if it's something or serious enough. But let me be clear, you don't need the perfect words. You just need to speak. And that is where what we need to talk about with birth plans and expectations. A birth plan is not about controlling every moment. It's about communicating what matters to you. It's a starting point for that conversation because the birth is dynamic and things can change along the way. But even when if plans change, your voice should never be removed from that process. You still deserve to be informed and included, and you deserve to understand exactly what's happening to your body. I remember a patient who kept saying, I don't feel right. I can't explain it. I just don't feel right. And her vital signs were not alarming. Nothing obvious was jumping off the chart, but she kept saying it. And because of that, we took a deeper look and we found what could have been missed if we had relied only on what we saw or felt. The moment reinforced everything that I carry with me every day. Patients don't need to prove that something's wrong to be taken seriously. Their voice is part of the assessment. And I'm just going to read a quick excerpt from the book. And this is talking about birth plans and managing your expectations. A birth plan is a valuable tool for communicating your preferences, but it's essential to approach it with flexibility and self-compassion. Many birthing people create detailed birthing plans, outlining their desires for pain management, labor positions, interventions, and postpartum care. Don't internalize them as something you must accomplish. While planning is empowering, it's also important to recognize that birth is unpredictable, and the most important outcome is a safe and supported experience, whatever that takes, whatever form that takes. Many clients express a strong desire to avoid pain medication. I have often heard people say, I didn't want to use pain medication. This phrasing can unintentionally carry emotional weight, suggesting that pain medication should be avoided at all costs and that needing it equates to a loss of control or strength. This perception can create an emotional burden where the birthing person feels that a specific outcome validates their efforts and anything else is a form of failure. Birth is dynamic and your choices are valid, whether they align with your original plan or not. Instead of seeing your birthing plan as a rigid set of rules, consider it a guide, a way to communicate your hopes while you're preparing for changes. If your birth plan includes unmedicated birth, but you decide to use pain relief, it doesn't mean you gave up. It means you made the best choice for yourself at the moment. Your birth plan is not a tool and it's not a test. No, sorry. Your birth plan is a tool, it's not a test. It doesn't measure your strength, capability, or success. A shift in your plan does not mean you failed or that your birth was any less valid. What matters most is how you feel supported, respected, and cared for during the process. Birth is not about perfection, it's about meeting your baby in the safest, most supported way possible. Be kind to yourself, honor your journey, and know that your experience is uniquely yours. And remember to give yourself grace.
Thank you, Dr. J. Now, many families face barriers like transportation, work schedules, or fear of the healthcare system. What encouragement would you give someone who is hesitant about seeking prenatal care?
I always say if you're unsure that you need to speak up again. There are people that are in different areas that are there to help you. I know that getting care sometimes feels hard and it feels like you're alone and you have transportation problems and work problems. Those are real and they can make you feel overwhelmed and even to take a first step. But it's so important to receive the care that you need because you matter and your health matters. So your pregnancy, you're going to reach out and there are people, your provider you can speak to, people in the community support systems that really want to try to help you get the care that you need. So if one door doesn't open, I want you to try another door, but you need to speak up and let us know what your needs are because the right support does exist and you deserve to be supported in those ways. I've had patients come late or miss visits, but if we don't ask those questions as the provider and as the people in the systems, what's keeping you from getting here? What's making it hard? Then we can help the system set up things. We could have maybe evening clinics if or if you're having problems with transportation, some hospitals give vouchers for taxi cab fares. When I worked in the Bronx, we had elevated trains there. And my poor mothers, when they were pregnant or when they had just had their babies, they had strollers, they had diaper bags. Imagine them trying to get up the stairs of an elevated train. There were no elevators there. They would have to wait till a nice gentleman came by and helped them with the stroller. So they often got to their visits very late or missed the visit altogether. So we have to reach out to our clients too and find out what barriers they're finding and try to see ways to alleviate those.
And the final thought, what message do you hope readers take away from your journal about caring for themselves and advocating for their health during pregnancy and postpartum?
Okay. I just want to share, I think the most important thing is I want people to be in a community. It's not just about that mother or the birthing person or the expectant family. It's a community thing. I want everybody to take ownership of this because every child enters a community, not just a family. And today we had the opportunity to think about the role that each of us play in supporting them in that journey. One of the things I often hear from people who pick up my journal is that they may not need it today, but they know somebody who will someday, a niece. We have to remember we have granddaughters and we have daughter-in-laws and we have, we're aunts and we're all these people to all these people. Sometimes the person who needs it now isn't the one sitting in this room today. It's someone that is going to share this information with that person. We have to be intentional. And in one way that we can start to look at that is to think about the role that we play in supporting the families through pregnancy and through the postpartum period. I just want to make sure that everybody knows that if they get this book, I will do a signed book plate if they want to have a signed autographed copy. If they just go to my website and put in their information, I will be happy to send them a signed book plate so they'll have a book there. And basically, this book is just, I want people to hear what is normal, what is not normal. I want them to have some information so that when they go to see their provider, they come armed with some information and they can have a place to reflect and write their thoughts and take the book with you into your provider's office so that you can share your questions and your thoughts with them. And the main thing I want them to know when they put this book down is that they have a voice. We're not on a conveyor belt. There should be communication. They should be at the center of their care. And I want them to enter this pregnancy and their birth with joy and feel that they have the information they need to walk into this experience. This is a transformative experience and it should be joyful, not with fear, but with joy. So that's what I leave you with. And my mantra is because babies should go home in their mother's arms.
Thank you, Dr. J. And we have time for a few questions before we close. You can put your questions in the chat. And I have to say that your approach to prenatal visits, postpartum visits, listening to the person, centering the person is so important. If you don't feel centered, if you feel that you're being rushed, let the provider know and they can adjust. You can say, if you were in my shoes, I think you would want to have the time to ask the question or be clear about what's next, etc. And let's see what the questions say.
While you're looking at your question, I just want to say one thing. As a provider, I've had patients tell me, Janet, did you hear what I said? And you know what? I want you to give your provider grace, but not too long. Put it that way. There are so many things happening at one time. I could be talking to a client and someone knocks on the door and my thoughts just went to the knock on the door. So if I missed something. I used to tell my patients, if you think I didn't hear you, say it again, or you call me out on it, because the phone can ring, the knock on the door, that can take my mind off what you just said, or I might miss something. So it's very important that if you don't feel heard, that you speak up. And my patients would tell me, Janet, did you hear what I said? And I'd say, please explain it again or tell me again. And that's okay that you speak up and speak with your provider.
And then here's the question: how does the act of journaling specifically help a pregnant person navigate the physiological and emotional transitions of pregnancy?
I would say I'm a journaler from way back. I think that when you journal, it gives you time to slow down and to really think about how you're feeling and to verbalize it. Start to verbalize it on your paper. And that way, when you go to see your provider, if there's something that you want to talk about, or if you're feeling a certain way, you have already processed it or begin to process it on your own without any outside pressure. It's you thinking about what you need. What are your needs? What are the cultural thing? It might be something that in my culture, this is important to me. So journal it. There's a part in the book about culture. What's important to you? What do you want included in your birth? And so if you document it and have the time to sit down and think about these things, then when you go in, it's a conversation. I would like to have a prayer immediately after. My patients would come to me. I had some patients, I had quite a few Muslim patients, and the father would say, I want to be the first one to speak over my child. So when that baby's born, that room would be quiet. Nobody would be yelling out, it's a boy, it's a girl, or any of that. It would be quiet. The father, as soon as the baby was born, we would put the baby on the mother's chest to do skin to skin. The father would come over in a quiet room and he would pray over that baby. And so we need to know culturally what is important to you. We could have, somebody might say, I need music in my room, or I need whatever. Those are things that if you're sitting down and you're journaling, it's part of the book. There's a part about culture. There's a part about space for reflection. There's a vision board. So there's places to write down and to make you start to think about these things, these prompts.
And you include affirmations
I
also.
do. I do.
Affirmations are also strengthening and healing. And the next question: in your experience as a midwife, what is the most common concern women have during their pregnancy transition that isn't discussed enough in the family? Maybe breastfeeding?
I would say that would be a big part. Okay. Yeah, that could be a large void there. I've had a lot of patients that want to breastfeed, for instance, and when people have babies, families come from everywhere. And if that hasn't been discussed, sometimes that can be a barrier. If the family is not supportive of breastfeeding, there's a lot of things that mom and expectant parents have talked about, and you need to include the family that's going to be in your presence, what your plans are, so that you get support and not opposition. And one of the things I do talk about in the book is barriers also. That's another big thing, is emotionally learning to set barriers, and to because that emotionally that can be hard when there's 2,500 people speaking into what you should do and you have your plan already. So those are the kind of things that you can talk to families about, the people that are going to be around you. We're planning to breastfeed, and this is what, this is way you bring them on board. And if they hear it during the pregnancy, by the time the baby gets here, they already know what your plans are and they can be supportive.
Thank you, Dr. J.
Mm-hmm.
I think that's, I don't see any other questions in the chat.
I see
So I
one
want to thank.
question from Valerie. Where's my office, city and state? Valerie, I am no longer doing clinical practice. I left in 23, and now I'm just speaking and writing and meeting wonderful people and sharing with providers and families things that we can do to help improve the maternal health system. But I no longer am in an office.
And there was a reply to that question, but I love your answer. Thank you. So I want to thank you, Dr. J, for sharing your insight, your expertise, and your time with us today. And thank you, everyone, to everyone who joined this session and engaged in our discussion and submitted questions. We're grateful for the time you spent with us. Um, and I want you to know that the Safer Births Now virtual conference is made possible through the support of our title sponsor and program partners whose commitment helps advance safer maternal and newborn care. And we do have a newborn care program coming up. And we extend our sincere thanks to our title sponsors, Birthing the Magic Collaborative, Black Coalition for Safe Motherhood, and Transitions Women's Health Consulting. That's Dr. J's program. So, and then we have program partners, Navigate Maternity, A Light After 9, Chi Eta Phi Sorority, Herd App, and Hive Impact Fund. Lastly, we want to thank Your Village Studio for their outstanding technical and administrative support. So now we have a rich lineup of sessions scheduled throughout the conference, and we hope you'll keep engaging with us. Please visit the conference website. Did you put that in, Marie? The conference website, so that you can join the sessions that speak to you the most. And please continue with the conversation with us in social media using the hashtag SaferBirthsNow, and follow at Safer Births Now for updates, resources, and upcoming events. And this is recorded, so you'll be able to check out the recording on Birthing the Magic's YouTube channel. So thank you again. Thank you again, everyone, for being part of the Safer Births Now community and movement. Community and movement towards safer, sacred childbirth. Enjoy the rest of the conference.
Bye,
I just
everyone.
have to do a quick thank you to Dr. J and give her a shout out. She was the first person I told about this concept. What was it, Dr. J, 4 years ago
4 years
now?
ago? Yeah.
4 years ago. And I'd never met her before. I was running through Whole Foods in Lake Tahoe, remember? And she had never met me before, but she immediately said yes. And she's been such a blessing to our work now for 4 years. And I'm so proud of not just this book, but you have three,
No, there's
two,
another
two,
one.
two books now.
Yes.
And just, it's like having a best friend. So. Well, thank you all. In 2 minutes, we're going to be chatting with Shafia Monroe. So you'll have to log out. If you don't have the link, check your email. We sent it out to everyone that registered for Dr. J's workshop. Thank you so much for joining us, Dr. J. We love you. And we'll see you later this week. That's
Yes,
the other
ma'am.
thing. She's supporting us and she's always sharing. So she's going to have a wonderful conversation about preconception. So we'll see you later this week, my friend.
Okay, take care.
Thank you.